Thanks for checking in for the second episode of Total Thyroid with John Russell. For those of you who might be listening for the first time, I am a board certified thyroid and parathyroid surgeon. That's all I do, thyroid and parathyroid surgery only. And that's all I've done for the last 10 years. I was the director of the Johns Hopkins Thyroid Tumor Center until I left in 2024 to start the Russell Center for Endocrine Health just outside of Washington, D.C. So thanks for listening. Today, I wanted to talk about scarless thyroid surgery, and it seems like a funny thing to start talking about for episode number 2, especially because episode number 1 was just kind of an introduction about who I am and why I think maybe I have something to say about the thyroid. Hopefully you agree, because what I think doesn't really matter. It's kind of more what you think. But I wanted to start with scarless thyroid surgery because that is actually the thing that you are least likely to hear about when you talk to your surgeon or your doctor before you have thyroid surgery. And so even though it's early on and we haven't even talked about what the thyroid is and all the rest of that, I'm going to make an assumption that you, my audience, kind of know most of that stuff. You know that the thyroid takes care of metabolism. You know that it's super vital organ. It makes you feel well. It makes you gain weight. It makes you sleep. Fatigue, brain fog, hair loss, all of those things can happen from thyroid, because any medical condition could be caused by a thyroid problem. And without too much exaggeration, and that's actually true, your thyroid exerts a huge effect. But as we also know, most medical conditions are not caused by the thyroid. And so I'm not going to go into that too much right now. Maybe I'll touch on it a little bit, but if that's kind of the angle that you're looking for, there's a lot of other good content that's out there to talk to you about the nuance of different tests and should you have your TSH only or your T3, T4. There's a lot of really good content. And of course, I do have opinions on all of that, but I'm not going to really dig into that right now, because what I want to focus on is scarless thyroid surgery. So we're going to assume that you know, or that you know someone who knows that they need to have thyroid surgery. And as you're going through that, you know that the traditional way to do thyroid surgery is to make a cut kind of in the middle of your neck. It was actually popularized by Theodore Coker, plus or minus 120 years ago. And the original incision started off as a vertical cut, but then they decided to orient it horizontally because it was more cosmetically favorable. Because then, as now, most patients who have a thyroid problem and need surgery are actually young women. And having a big, ugly scar in the middle of the neck, especially one that went up and down and was obvious, was not something that people got really excited about. And so Dr. Coker back then, he actually won a Nobel Prize for making thyroid surgery infinitely safer. And for all intents and purposes, until kind of my career started at Johns Hopkins in 2015, we did surgery exactly the same way as he had done it 100 years ago. And it's a great surgery. It's very elegant. It's very safe. It's very predictable. If you have a surgeon who does lots of them, you can be almost certain that you're going to have a good outcome with regards to safety during surgery. And so why are we talking about scarless thyroid surgery? Well, because of the fact that a lot of people start to talk about that scar in the middle of the neck. Again, most patients, they tend to be young women, and having a scar right in the middle of the neck is something that for some people can be a distraction. And we've actually done a lot of research on that. And the reason that I'm talking about it is because while I was at Johns Hopkins, I really wanted to know whether or not how we did surgery actually impacted patient outcomes. And what that means is with regards to safety, with regards to swallowing and voice outcomes, with regards to overall quality of life, and even just the cosmetic impact of having thyroid surgery. Because a lot of the reasons that we have thyroid surgery aren't for cancer. We'll also do surgery if somebody has a big goiter and you can see a lump on their neck. That would be a cosmetic reason to do it. Or if somebody has Graves' disease, and goiters, I should clarify, you don't just do surgery for a goiter, for a big thyroid, for a cosmetic reason. You actually do it because it's affecting your swallowing or your breathing or your voice or something like that. But yeah, sometimes people do it because it's just not pleasant to look at this big lump in your neck. And so there's lots of things we're going to talk. Don't worry. We're also going to talk about radiofrequency ablation and nanopulse and all sorts of technologies that don't require surgery and might be able to shrink your thyroid. We'll get there. But for today, we're talking about the scar. So first of all, what is scarless thyroid surgery? Well, it kind of refers to the idea that your scar isn't visible. And it's not actually scarless. There is no surgery that you can do that doesn't cause a scar at some point, even if that scar is internal. That there's a few different types of scarless thyroid surgery. You can go in through your areola in your breast. You can go in through your armpit or your axilla. You can go in your hairline back behind your ear, or you can go in through your lower lip. And each of those procedures can sometimes be called scarless. Most of these procedures we prefer to call, in the scientific world, we call them remote access thyroidectomy, which has a great abbreviation, which is RAT. Believe it or not, that didn't really catch on with the public, so we don't really use that acronym. But the one out of all of these, and I'm not going to talk about this too much, but the one that seems to have the least pain and have the best access for doctors and be the easiest to learn and has numerous other advantages, it's a little bit less expensive, a little bit faster, is the transoral thyroid surgery, where we actually aren't going through your mouth, but we're going through your lip. So we kind of make small incisions inside of your lower lip, and that's how we do your surgery. It's kind of like taking your gallbladder out. We used to make a big cut to get down to your gallbladder or your appendix, and nowadays most of those surgeries are done through just these little keyhole incisions, except for we don't want to put the keyhole incisions where everybody can see them. And so instead we hide those keyhole incisions inside of your lower lip. And then we just use long instruments to do the surgery, or maybe we use a robot. There's lots of different ways that we can do it. At the end of everything, miraculously, you have less pain and a better recovery and better outcomes in numerous different ways, which we will talk about later. But for right now, what you need to know, that's what I'm talking about when I say scarless thyroid surgery. In my practice, after looking at all the different approaches and doing most of them, it seems like transoral thyroid surgery seemed to have the best outcomes and be the most reproducible. And so that's the one that I do, and that's what I'm going to talk about. That is the one that is most commonly done in North America. There are a couple of surgeons who do the axillary approach. There's a couple of surgeons who do the breast approach. And there's one who used to do the retroauricular. I guess there is another one who does the retroauricular, but it's a small world. There's probably about 10 of us who do these on a pretty routine basis. Of them, I do by far the most. At different times in the past, I've done more than all of them put together of the different transoral approaches, but I just do a lot of them. So let's talk about that a little bit more. The first thing to talk about is, why would you do a scarless thyroid surgery? And the first thing that comes to mind is vanity. People feel really guilty talking about having a scarless thyroid surgery. And it's almost like people are apologetic when they talk to me and they say, I guess I'm a little bit vain. I don't really want to do it. And I kind of try to stop them right there, because having a thyroid scar to me isn't necessarily about vanity. It's more about privacy. I don't want to have to explain about thyroid cancer or about any of my personal health information unless I want to volunteer that information. And the thought of standing in a grocery checkout line and having the rando behind me say, "Hey, what happened to you?" isn't really appealing to me, especially because the act of having thyroid surgery is pretty emotional. And it's a personal decision to have, and if you want to talk to the guy behind you in the grocery checkout line, I'm sure they would be more than happy to listen to you, but you don't want to have to. And so I think, for me, when people say that it's about vanity, I try and stop them and say, I'm not sure that I would call that vanity. I would call that more just privacy. If you want to be a private person and keep your health history to yourself, then yeah. I mean, there's a big reason in the United States we have all these laws protecting your health privacy. Like, I can't just go and tell you what famous person that I operated on, right? Like, I can't talk to you about that, because we understand that people's health information it's almost sacred, right? Like, we don't just share that with everybody. And so if you have a big scar across the front of your neck, you're sharing with everybody, oh, I had a thyroid problem, I needed surgery. You're just broadcasting a lot about yourself. So that's to me more of the reason. Interestingly, as we've done more and more of them, we've learned other benefits, which I will get into a little bit later. There's less pain when you have scarless transoral thyroid surgery. Recovery might be a little bit easier, better quality of life, a whole bunch of other things that we will get to later. So first of all, I need to talk to you about some of the earliest research about a scar, because again, the traditional surgery with a scar across your neck, it heals well for almost all patients. For some patients, it can even kind of almost disappear over time. But we as doctors, this is almost embarrassing to say, but we can get a little bit dismissive. If we look at a scar and we say, oh, it healed great, you're fine. Sometimes that's good enough for us, and we tend to dismiss what patients are saying or feeling. I'm sorry. As a doctor, I'm sorry. I recognize that sometimes we do this. And most of us are learning this and we're trying to stop it, but sometimes we still do it. And all through my training, I remember the people that were teaching me saying, hey, don't worry about your scar. It's going to heal great. And it's pretty dismissive to say that, because we know that most people heal great, but a significant percentage of patients will either have a hypertrophic scar or it won't look appealing. And there's some research that kind of goes into the fact that people really have some regrets about their scar, and they are even considering plastic surgery down the line. We'll get to that a little bit later. But I want to pause, because from my point of view as a surgeon, we always talk about the idea of first do no harm. And so the first thing that has to happen, if I'm going to learn a new technique like scarless thyroid surgery, the first thing that I have to make sure of is that I'm not hurting people, that this new technique is just as safe as the surgery before. And so that's pretty hard to do. And that's part of why nobody really innovated with thyroid surgery for 100 years, because traditional thyroid surgery, again, if you go to a high volume surgeon, it's pretty good. There's the risk of hurting your voice. In my hands, that risk is less than 1 in 1,000. It's been years since I've had a permanent change in somebody's voice. There's a risk of hurting somebody's parathyroid glands. That risk is also incredibly low. Less than 1% in my hands. And so you look at these things and you start to say, boy, how do we do better than less than 1% as far as hurting patients? And it's almost impossible. And so that's part of the problem and why innovation hasn't really moved forward in thyroid surgery. So anyways, I guess just to cut through the long and short of it, at this point in my career, I've done close to 1,000 thyroid surgeries without a scar. And of those close to 1,000, I have 0 patients with a permanent nerve injury, meaning they can all talk essentially normally after thyroid surgery, which is one of the big risks of thyroid surgery. I say essentially normally because if any of my patients are listening, sometimes changes can happen just from removing a big thyroid, and your voice over time will start to shift and you might not even notice it. It will be imperceptible to you. And then when your thyroid comes out, it goes back to what would have been normal. And you might notice there's some subtle differences in your voice. It would be unusual for anybody else to notice those changes, but what patients perceive after surgery is they are the ones who know themselves better than anybody else. And so if any of my patients or anybody else feels like their voice changed afterwards, totally respect that, because you're the one that knows you better than anybody else. So that's kind of the key point. But in general, we kind of, as surgeons, kind of use a binary classification of whether or not your voice is working. It's a little bit of a blunt tool, but we put a camera down your nose if we're worried about it. And if we see both vocal cords working, then we say that you did not have the injury that caused a permanent nerve injury. And so then there's other tests that can do that could kind of tease out if you've had other injuries that might have predisposed you to noticing that your voice isn't quite perfect. We'll dig into that on a future episode, because voice changes after thyroid surgery is definitely something worth talking about. But I think the key point is there's a lot of data that says the voice outcomes are equivalent. So again, we'll talk about that a little bit more later today as well. But the key point for this is that safety with regards to transoral thyroid surgery, as you look at all of the data across the world, and certainly my data in my 1,000 patients, it is just as safe as traditional surgery. And so the first do no harm, scarless surgery, if you are worried about safety, as long as you are going to somebody who does lots of it, you will be just as safe as traditional surgery. So that's point number 1. And that's been replicated in multiple research studies. Again, each surgeon has a learning curve when they're learning a new technique. So if you're going to a surgeon who's never done scarless surgery before, maybe slightly different. You need to have a full informed consent discussion with your surgeon before you just assume that everything's going to be fine. but in general, it's just as safe as traditional surgery. People always want to ask me if it's longer or if it's harder to do. First of all, I appreciate patients being worried about me. If you're worried about it being harder or longer for me, that's very kind of you. But kind of, who cares? Who cares if it's longer or harder for me as long as you're safe? It is slightly longer. And so there is a theoretical risk of being under anesthesia a little bit longer. In my hands, it probably takes me about 15 or 20 minutes longer to do a surgery without a scar than it does to do surgery with a scar. So there is a little bit of a difference there when you're talking about that. Is it harder? Well, sure, it's hard to do something that you've not learned how to do during your training. But at this point, as the numbers start to get closer and closer to the open surgeries versus the surgeries without a scar that I do, it's pretty similar. But again, that's surgeon specific and who you're talking to and what type of case and where the tumor is. A whole bunch of different, more particular things to talk about. By the same token, people sometimes worry about whether or not it's more expensive. And one thing that was very gratifying for me was finding out, as long as you take the robot out of the equation. I don't use the robot at this point. I tried it in the past, and one of the reasons that I stopped was because it is astronomically more expensive to use a surgical robot. But I don't use the robot, and without using the robot, it is very similar in cost when you consider most things. That extra time in the operating room does have a cost associated with it, but overall, the cost between the two surgeries is fairly similar. And so that's pretty gratifying as well. And people always also ask, well, is it more painful? If I have surgery without a scar, is that going to be a more painful surgery? The answer to that one is an unequivocal no. We've got lots of different data that gives us that answer. The first amount of data came from international colleagues that have repeatedly found over and over that there's less pain when you have scarless thyroid surgery. But even at Johns Hopkins, we were doing a study looking at something totally unrelated, but we happened to include our patients who had scarless thyroid surgery. And what we found was that the patients who had scarless thyroid surgery had exactly the same narcotic demands as the patients who had traditional surgery. Which is one pain pill after surgery. So the night that you go home from thyroid surgery, you will have one pain pill if I do your surgery. And it doesn't matter how I do your surgery. Most of the time I hear from patients that they take it just to help them sleep. Whether or not that's a good reason to take a narcotic is, I don't judge right after surgery, but it's a fairly mild pain surgery, whether you have a scar or don't have a scar. So that's kind of the good news, and that's been replicated in study after study. Again, we talked about voice outcomes just a little bit already. I think the more important questions, as I'm a patient and I'm starting to think, and I'm going to share some of our research that we've done and some of the research that others have done. The first question is, does a scar really matter? Whether or not you have a scar, does it matter? And we tried to figure this out through a few different mechanisms. And one of the things that we did was we asked other people to look at pictures of people who had a scar on their neck. And then we asked the people who were looking at those pictures to tell us what they thought about the people who had the scar. And so they would then start to opine about different things. That person looks like they have a lower quality of life. They're slightly less attractive. And they would go on and they would tell us, they would make these judgments. And overall, we found that most people think that if you have a scar on your neck, you're slightly less attractive. And if you have a scar on your neck, you probably have a lower quality of life. And if you have a scar on your neck, they don't want to have one. They would pay more than $10,000 to avoid that scar that you have on your neck. And so that's one of the things that we found in one of our research studies. And then we went on and took it a step further, because what we really want to know is, what's the subconscious impact of seeing somebody who has a scar? And so we asked people to look at pictures on a computer screen of faces, and the faces included the neck, and some of the pictures had a scar and some of them didn't. And then we did exactly what Google does when they're in the middle of trying to see whether or not you're going to look at an ad. And we tracked the pupils of the people who were looking at those pictures to see if they focused on the scar. And you can really see these cool pictures. I'll try and put it up here. you can really see these cool pictures of a heat map that is generated by the pupils of a person looking at somebody who had thyroid surgery. Because as we all intuitively understand that when we're communicating with somebody and talking to them, we want them to focus in what's called the central triangle, the eyes and the nose. When you're looking at somebody, you want them to look you straight in the face. And if you've ever had a pimple or if you've ever had something else, you'll notice that as you're talking to somebody, their eyes start to drift down. And it's distracting, right? You just want them to talk to you. You want them to focus on your eyes. But if their eyes start to drift down, it's distracting. And sure enough, we were able to generate a heat map tracking the pupils of the people talking or looking at pictures of thyroid scars. And sure enough, if you have a thyroid scar, people will look at your thyroid scar. And so our hypothesis coming out of that paper is that if you have a thyroid scar, then that scar will distract others while they're talking to you. How much that matters, well, I'll get to that a little bit later. But we found that pretty interesting. And then we were able to move on and we were able to demonstrate that if you have surgery without a visible scar, specifically transoral thyroid surgery, that penalty is eliminated completely because there's no visible sign of the fact that you had surgery. And so everybody stays focused on your eyes in that central triangle. And the heat maps look really cool in the paper that we published that talked about that. So it's pretty cool. Apparently, other people do care if you have a scar and it will distract. I remember I went to a party one time with a woman who was kind of questioning my research. It's easy in the scientific world, if you publish a paper and you talk about scars, it's easy. I'm a cancer surgeon, right? So if I'm a cancer surgeon, why am I talking about scars so much? And I've had some people say, look, you're not curing cancer by avoiding a scar. More on that later. I'll come back to it, I promise. But so why is your research so important? But I went to this party with this woman, and there was a person at the party who had had thyroid surgery, and she was a beautiful young woman. And as we left the party, this woman who I was with said, yeah, I get it. All I could stare at was that thyroid scar, and it was distracting. And the good news is for most people, those scars heal really well over time and they tend to disappear. And so if you have a thyroid scar, it's going to get better. But if you have a thyroid scar, it might bother you. And in fact, there's some really good research that says that it does. So there's a study that says that if you have a thyroid scar, it affects your quality of life as much as if you had psoriasis or vitiligo. That's the patchy white patches of skin, or severe atopic dermatitis. And so having a scar, doesn't matter how well it heals, affects your quality of life, according to that study. Then there was another study at the University of Indiana where they asked patients 5 years after surgery about their thyroid scar and how well it had healed. And what they found was that the presence of a scar affected the quality of life so much that about 20% of patients were slightly self-conscious about their scar, and 10% of patients wanted to have plastic surgery to fix their scar. And this is 5 years after surgery. And to me, what was most telling was that only half of the patients thought that their scar was excellent. Now, I'm a surgeon, and if half of my patients think that I'm an excellent surgeon, then that means I failed half of the time, because I want every single one of my patients to think that I'm an excellent surgeon and that my work looks excellent every time. And so for me, that's an opportunity as a surgeon for us to do better. And so it turns out, yes, patients themselves actually do care about a scar. Yes, some patients care more than others. You can parse out the data and you can see that certain demographic groups kind of makes common sense that certain demographic groups care about a scar more than others. But yeah, in most groups, in most demographics, there are people who would rather not have to explain about why they have a scar or anything like that. Even doctors care. We did a study asking doctors to grade scars, and it turns out that if you don't have a scar, doctors think it looks better too. We went on to do kind of my favorite study. And in that study, we did a follow-up on all of our patients who were eligible for scarless thyroid surgery. And I should point out that because I know that I've invested a lot of my career in scarless thyroid surgery, that I kind of recused myself from all of the data on this project and all of the statistics and everything else, because I really didn't want to have my own bias impact the research. At this point, I had spent probably 8 or 9 years focusing on scarless thyroid surgery, among other things. While I was at Hopkins, I was also kind of the guy that did the biggest, ugliest cancers. So it was weird. I would do these scarless surgeries right next to an anaplastic thyroid cancer or a bad medullary or a metastatic papillary. It was kind of a very fun practice, very juxtaposed to these different tumor types. But anyways, I recused myself from the data because I didn't want to impact the results. I wanted to make sure it was true, fair data. But we asked 2,000 patients who were eligible for scarless surgery about their outcomes. And we asked them these results almost 2 years after their surgery. And we had only about 400 or 500 patients that responded to the study. But what we found, and there were about 250, 300 patients who had normal surgery and 130 patients who responded who had surgery without a scar. And overall, those numbers matched because it's about a 1-to-3 ratio. So if you're eligible for scarless surgery, only about 1 out of every 3 patients will choose to have scarless surgery, and the other 2 out of 3 will choose not to have it for some reason. But of the patients who were eligible for scarless surgery, we were able to compare their quality of life 2 to 3 years after surgery. It's actually closer to 3 years after, 2.7 years after their surgery. And we used a test called the SF36, which is an overall quality of life study. And it breaks down quality of life into multiple different domains, functioning, all sorts of different things. And as it breaks down those quality of life, it was a pretty involved study. We also asked about swallowing and about voice and about dermatology and how your skin looked to you. And what we found was that in every single domain that we tested almost 3 years after surgery, people had a better quality of life if they did not have a visible scar on their neck. And I still remember where I was when I got that data from the medical student. She called me and reported that, and I was in Saudi Arabia giving a lecture, and practically jumped. I had to call my wife right away and tell her because of how awesome it was to get that data, because it's what I had been seeing as I talked to my patients after surgery, but you don't want to bias yourself. You realize as a scientist that what you think you're seeing is sometimes not true. So actually having objective data of that was pretty fantastic. And what we especially found was, no surprise, that people who don't have a scar are more than 3 times less likely to feel self-conscious about their scar. So kind of common sense, right? Like if you have a scar, you might be self-conscious about your scar. If you don't have a scar, you're not going to be self-conscious about your scar. So that was kind of the big takeaway from it, was that quality of life is at least as good, if not better, in everything, and much better when it comes to how people feel about their scar and the appearance of their neck. So very, very gratifying information. So kind of to recap up to this point, first of all, we had to prove that scarless surgery was just as safe. Check. At least in my hands and across the world, even scarless thyroid surgery through the transoral approach is just as safe as the traditional surgery. Outcomes are just as good. Patients probably have less pain, voice swallowing, etc., all at least as good, if not better. To the point that in my practice, if I have somebody from Broadway who's coming from surgery, scarless thyroid surgery is kind of my go-to, because I know predictably they're going to do very well with that. As you consider all these different things, you then come back to, well, what's really the driving impetus? Is it just to avoid a scar? And I want to let you in on a little secret. For me, that's part of it. Yes, I want my patients to have the best outcome, but I'm also thinking about patients in the future. When surgeons do thyroid surgery, traditionally we wear glasses that magnify everything. We call them loupes. They magnify our ability to see the nerve and the parathyroid glands and protect you and keep you even safer during surgery. But we will always be limited by our eyes. We can only see what our brain can process and see. And most of us at this point have cars that help us as we're driving, or we use things, we just use technology that helps us out, and it makes our eyes even better than they are. It finds things for us and it protects us. And that is also what happens when you can allow cameras to help you during surgery. And so for me, academically, people ask, why do you focus on scarless thyroid surgery so much? My answer is, yes, I want my patients to have the best outcome right now, but I'm also thinking about patients 20 years from now. If I do scarless surgery, then I have to use a camera. And if I use a camera, then I get to record that data. And if I get to record that data, then I can give it to a computer. And if I give it to a computer, then I can use that to help me design safer surgery, so that as I start to get too close to that nerve, I can have some sort of blinking light that goes off that says you are in danger of hurting the patient if you continue. And that's going to make us all safer. We have the technology in other fields. Why don't we have it in surgery? Well, because we don't have videos of surgery yet. That's what we get to do when we do scarless thyroid surgery, is it gives us the ability to capture that data so that we can keep our patients even safer and make it even better. And so that's what I'm hoping. I'm hoping that in the future we can record all of these surgeries and we can make them available to train different devices to help us be safer and we keep you safer. So that to me is kind of it. And as I've explained this, the most common question that I get from patients is, why don't more surgeons offer scarless thyroid surgery? I don't know. Well, I do know. I have ideas at least about why they don't do it. But it's part of why I left Johns Hopkins. I spent 10 years kind of hitting my head, banging my head against the wall, trying to get other surgeons to adapt and adopt this new technology. I think the biggest reason is that once you leave training to learn a new technology, you personally are taking the risk on. If something goes wrong, then and you're doing a new procedure, then people look at you and say, why did you do that? The old way was very good. Why did you try something new? And that's a scary thing. As a surgeon, that's very scary. And so it's also very humbling as a surgeon. Most of these surgeons are very experienced surgeons, and for them to decide that they want to learn something from a junior surgeon and kind of step back and do that, that's a hard thing. That's a hard pill to swallow. And so trying to get more senior surgeons to adapt to this technology and pick it up has been very challenging, not just in the United States, but really across the world. And so it's usually the more junior surgeons who do it. And in the United States, most patients try to go to a more experienced surgeon, and that's appropriate because you get better outcomes. But it does make it harder for us to disseminate new technologies and new techniques. And so it's really challenging to be able to get new surgeons to do it for all of those reasons. It's hard. And there's a very well-known program on the West Coast that advertises to this day that they do scarless surgery, and they just don't do it. And instead, patients will come in and they will see a surgeon and say, hey, could I have scarless surgery? And those surgeons will say, no, you're not eligible. And sometimes those patients call me, thankfully, hopefully they call me and they say, hey, I was told by this well-known program that I'm not a candidate for scarless surgery, but I think I probably am. The answer is yes, you are. Almost always. The vast majority of patients are eligible for scarless surgery. And so if your surgeon told you that you can't have surgery without a scar, try and talk to us. Maybe with them, that's true, because each surgeon, as you get better and better, you can do more and more surgery. But in my hands, most of the time, most patients are eligible. And it's not just my hands. We did a study with University of California at San Francisco and University of Chicago. That surgeon has moved down to Baylor. Most patients are eligible for scarless surgery, not just from me, but from surgeons who are competent and who do lots of this scarless surgery. So that's part of the problem, and why not everybody is getting scarless surgery is because if surgeons don't know how to do it, they might say, or if they know how to do it but they don't do it very often, they might say that they do it but then not do it enough to feel comfortable offering it to you. So if I can help, if you have a question, please reach out to me. I'm happy to always answer questions about that. So anyways, as we wrap up, just kind of to put everything in a nutshell, scarless surgery, now you've learned about it. It is just as safe as traditional surgery. It probably has at least as good, if not better, outcomes with regards to voice, probably definitely better with regards to pain. Overall quality of life, at least as good, if not better. And most patients are eligible for it. Patients with cancer, yes. Patients with benign goiters, yes. Patients with Graves' disease, yes. Patients with Hashimoto's thyroiditis, yes. All of these patients are eligible for it. So if you have questions about scarless thyroid surgery, please reach out. From my point of view, it's part of how we move the field forward. Theodore Coker won his Nobel Prize 100 years ago. That was fantastic. But the field of thyroid surgery has kind of stalled since then. So this podcast is about bringing you new technologies and helping you learn when they might apply to you. So if you hear this and this is something you might want to share with people, I'm kind of appalled. Just in the last 6 months, There have been a couple of cases of fairly well-known people who have had thyroid surgery for tumors that very easily could have been removed without a scar. And they've got a big scar on their neck, and they didn't call me. And it's kind of funny. Maybe they wanted the publicity of having a scar on their neck. Maybe it was part of their play. I don't know. But most of the time, most people just would rather keep their health information private. And so in that situation, boy, I wish they would just give me a call and kind of check in and see if there's a way that we can help them. So anyways, this is episode 2, scarless thyroid surgery. Tune in for next time. We'll probably talk a little bit about some of the other technologies and how they fit into thyroid and parathyroid surgery. Probably dig into either parathyroid autofluorescence or some of the thermal ablation techniques, and we'll differentiate between all of them. So stay tuned for the next one. Please share this podcast with other people so that I think that it's worth doing. But thanks for listening, and hopefully that you guys enjoyed. Talk to you later.